So, welcome back everyone to the part 2 of the DAMS Grey Matter quiz. And I'm super excited to be with you now to conduct the final 3 rounds. And what we have done is we have made a very interesting round for you where it is called as the multiplier round, where you can see we are progressively multiplying your scores, or we call it as a chain reaction round. In this round, what will happen is you will have total 5 questions for each team. Okay, and in one question, if you answer the first question right, you will get 5. If you answer the second question right, you get 10. Third question right, you will get 20. Fourth question right, you will get 40. Fifth question right, you will get 80 in 30 seconds. Okay. There will be no pass. If you mark any answer wrong, you will have, you will lose all the marks and you can quit and keep the marks. You try to understand. If you get a question wrong, if you say I am playing, you get it wrong, you will have 0 marks there and you will not be able to proceed. If you say okay, I am quitting this question, then you will get the marks. Okay, so the entire idea is you cannot pass any question.
Sir, can you repeat, please?
Okay, Deep, I'm repeating for you. So
Yes, sir.
in this question, what will happen is it is called as the multiplier round.
Yes.
Every question, if you answer first question right, you will get 5 marks. Okay. Second question, 10. Third, 20. Fourth, 40. Fifth, 80. 30 seconds total time is there. Okay. But the question is that if you answer something wrong, okay, if you answer a question wrong, then you will lose all the marks. But you can quit and you can say, I will quitting. You can quit and take those marks. Okay. I will explain when we are going forward. I will explain also. So, first question for team A. Team A from Kolkata. I want you to put on your cameras, both of you. And so, yes.
Sir, sir, means if we are not answering, then we can move to the next question and wait,
No.
means answer it later.
No. If you say there is no pass in this question, so if you are not
sir.
answering the next question, that means you are quitting that round. I'll explain.
Okay. Means
I will
no
explain.
way.
This is not a rapid fire round. That is a separate round.
Hmm.
This is a multiplier round. Every progressive question, if you keep getting right, the marks will keep increasing. But suppose you are at question number 3 and you say, I don't know the answer, then the round will finish there and you will get that many marks. But if you answer it wrongly, you will get 0 and all the previous marks will go.
Oh, अच्छा.
Okay. It's like little bit of gamble, but little bit of reward also. So let's start with the team 1. Okay.
Excuse me, sir.
Yes.
Every
Oitagni
question has
ready
30
achies?
seconds or total round has 30 seconds?
Total round 30 seconds.
Oitagni ready achies? Oitagni, are you ready?
What we can do is we can give you 30 seconds per question. 30 seconds per question. I see that the questions are a little longer and it might take time in the. So per question will give you 30 seconds. Okay. All set? Shall we start? Okay, now get set.
Yes.
Go. First question. Look at the first image and tell me how are they linked to anatomy and what are these images showing you?
ওইতাগ্নি এটা মসি ফাইবার বলবো সেরিবেলামের মসি
ও
লাগছে
হ্যাঁ এটা প্রিভিয়াস কোয়েশ্চেন ছিল মনে হয় হ্যাঁ
ঠিক আছে তো বলবো তো টাইম আউট ওয়েট কর তুই আরেকটুখানি যদি কিছু ভাবিস মসি ফাইবারস আর জলটা কি জন্য ফেলছে
কিছু ডাউনওয়ার্ড কিছু কন্ডাকশন দেখাচ্ছে না এই ডান দিকের পেন্টিং সম্বন্ধে আইডিয়া নেই
টাইম আপ স্যার
Your time is over. You want to give any answer?
Sir, here it is mossy fibers we are taking for cerebellum. Means mossy fibers are give input to the cerebellum because it is.
So unfortunately, it is not correct. So we will not be able to give you any marks, and so this round gets over for them, and they go beyond without getting scoring any mark. Let me tell you the correct answer. Anybody from the audience or from the YouTube subscribers who are looking at the video, which was going live, anybody has an answer? Please let us know in the chat box. Anybody else from the participants? Just to
yes, sir, hematoxylin and eosin.
Yes, correct. So it was the correct word was HNE stain. The first image was showing you hematoxylum campechinum, and os is the goddess of war. HNE is what is used in history. And well done, I think the BHU team. But now we'll go to the second team. Okay, we'll go to the second team, and for the second team, before I go to the second team and take questions, I want to put the remaining questions to the audience. By audience, I mean not the participants. I mean the YouTube subscribers, if they are not able to answer, you rest of the teams can answer, but there will be no marks for now because they could not see the 4 questions. I want to show you what the questions were. This is a 10-year-old boy who had sudden onset headache, vomiting, coughing, and collapse. What is your diagnosis? Anybody from the audience in the YouTube? Okay. Anybody from the participants?
Sir, colloid cyst on the foramen of Monro.
Perfect. This was the colloid cyst at the foramen of Monro. And I'm so happy that you could get it right. And the headache and vomiting was happening because of the sudden hydrocephalus that happens when you have a cyst at the foramen of Monro. Okay. Next question was, I think there is some, are you able to see the full slide or it is cutting?
No, sir. It's cutting.
Cutting. Let me just get it corrected. Give me just 1 second. I have resorted the actually the resolution. I think we should be back. I'm zooming myself in. Give me just 1 second. Now, I think now everything should be perfect. So let's continue with the question. The question was Mary Britt and Edward Moser were awarded Nobel Prize in 2014 for discovery of which cells? And where are they located? These are the cells. They are called as the GPS of the human brain. Anybody in the audience has the answer or the participants? What are the names of the cell for which they got Nobel Prize in 2014? Okay. So the answer was, I think none of the candidates know it. The answer was grid cells, which are located in the entorhinal cortex. And the next question that we had for them, which they could not unlock, was we had to identify A and B. And in pregnancy, which of these cells will be more? Okay, so these were the images that were shown to you, and you had to tell in pregnancy which of them will be more. Anybody from the participants wants to tell the answer?
Intermediate cell.
B is the intermediate cell. Okay, A. This is the B intermediate cell, but what about A?
A is a superficial cell.
And in pregnancy, which of them will be more?
B will be more.
B will be more. Perfect. So that was the question that they missed out on. So this was the 4th question. And if they had reached up to 5, the question was with respect to thyroidectomy, you had to identify triangle A and B and mention their contents. So there are 2 triangles shown to you and you had to mention them. Anybody wants to tell from the audience in the YouTube comments, or anybody wants to tell us right now, what is A and what is B? Which triangles are these in thyroid surgery?
So B is
That
bare.
is B Brand's triangle.
Perfect. And
Here,
A?
sir.
Jaws.
Yes, perfect. A was triangle of Zoll and B was Bayer's triangle. And the A had the content of superior laryngeal nerve and superior thyroid vessels. And B, the content was recurrent laryngeal nerve. So now you have gotten hang of it that if you could have answered, this is how the quiz would have progressed. I did a sample for the subsequent teams. Now what I'll do is team B. Team B, now I want you to put on your cameras Shivan Singh and Soumya Behra from BHU. I think you were answering very well when it was not your quiz. Let's see how will you do when it is your quiz. I am putting on the question for you. Ready? Okay. Identify the dotted areas of cells.
रुक जा फिर भी. Sir, this is Heller cell.
They are saying Heller cells, and it is absolutely correct. These are infraorbital ethmoidal air cells. They get full 5 marks and they get the ability to see the next question. Well done. You are on fire. Okay, ready? Okay. Next.
Yes, sir.
This was the answer, Heller cells, which was the answer to the previous question. Let me show you the previous question. Mention the new drug FGF2 approved for cholangiocarcinoma. Name the drug.
कुछ रुक जा, वो इनफिल से कोई नाम था उसका. इनफिलग्री समथिंग, मेरे को नाम नहीं याद आ रहा. नया 2022 वाला है. इनफिलग्री समथिंग.
If you get it right, you will get your score will you will get plus 10 marks. You get it wrong.
अरे हाँ, वो नहीं कर सकते हो.
अगर गलत हो गया तो सब छिन जाएगा. छोड़ दिया तो एग्जिट हो जाएगा.
क्या था यार, याद है क्या? शिवम क्या करना है बता.
Time up, sir.
So your time is over. Do you want to quit or do you want to attempt?
क्या करना है बता, क्या करना है? छोड़ देते हैं क्या?
Okay, so we will give them
quit. Yes, sir. We will
okay,
quit,
so they get only the 5 marks that they got for the previous question. They don't get any extra marks. The answer was pemigatinib. So that was the answer to the drug. And I also want to show to you the questions that you could not get. Let's see. The questions that you could not actually see. One was a question like this. You had to make a diagnosis on the X-ray.
Yes, sir. So this is subcutaneous emphysema.
This was subcutaneous
Ginkgo leaf
emphysema,
sign.
and you could see the ginkgo leaf appearance. The muscle striations are prominent. Very good. But that is something that was not there. And then there was a question on identifying the incisions B and C.
Yes, sir. Lange incision and Rutherford Morrison incision.
Lange and Rutherford Morrison was the correct answer, but unfortunately we could not reach there. Okay. And the fifth question actually for you was, what is Halzon syndrome?
Halzon syndrome सुना सा लग रहा है ना?
I told you we've kept the level of the quiz higher up so that we can enjoy the process, because you are all winners from all over India and you deserve to be challenged. Anybody from the rest of the audience who wants to answer this question? What is Halzon syndrome?
Fasciola causing asphyxia.
I think you're perfectly right. Let me explain to you. It is an allergic pharyngitis happening in response to Fasciola hepatica, which causes acute pharyngitis and edema, which leads to angioedema and death. That was the fifth question. It was first found in Lebanon. So that was the question that we wanted to, see, and you could get one correct. This is a multiplier round. If you keep getting it right, suddenly the scores will change. So we come to the next team now. Team 3. Are you set? Team 3. Akash Anand and Mukul Bhuria
Yes,
from
sir.
MAMC and ACMS. Rest
Yes,
of the
sir.
people, please put your camera off.
Yes, sir.
Shivam Singh, camera off. You're talking to somebody else. Okay, perfect. Okay, so now the rules are same. Let me show you the question. This is the first question to open your account. Identify A and B in this image.
अरे ये हिल वाला है ना, जो अपन बिल्स वाला, जो उसमें से 4 नाव निकलती थी.
बिल्स बार वाला ना.
हाँ, बिल्स बार वाला.
ए और बी. ये बी हॉरिजॉन्टल है, ए वर्टिकल है. मेरे बिल्स बार वही है यार.
अरे बिल्स बार तो है यार. नीचे वाला क्या है? ऊपर वाला बिल्स बार है, नीचे वाला क्या था?
प्लेट कोई कौन सा प्लेट का नाम ले ले कोई.
टाइम इज अप सर.
Time is up. Final answer.
ए बोल दे.
अरे फैल्सिफॉर्म यार.
ये तो बोल दे.
सर बिल्स हिल्स क्या था?
बार.
I think you're on the right track.
Bills bar,
Say the
sir.
answer.
Bills
Yes.
bar and falciform crest.
So they are saying Bills bar and falciform crest, and which is absolutely correct. They get +5 marks. Great answer. Great. I thought you had lost the track, but in between you got the track back. Second question. Now this time it is for 10 marks. 32-year-old female has presented with weakness, lethargy, history of nausea, vomiting, abdominal pain for 2 days, vertigo, LMP unknown, anxious, sweating, pale, vaginal bleeding, tachycardia, low hemoglobin, low BP, others normal. What is your diagnosis and next step?
Weakness, lethargy, nausea, vomiting,
abdominal pain, amenorrhea. You could, you have to find out.
क्या लग रहा है? मतलब काफी वीक्स.
मैं तो यूपीटी करा दूंगा ना.
डायग्नोसिस लेकिन क्या बोलेगा? प्रेगनेंसी बोलेगा? एक्टोपिक.
तेरा कुछ है तो बता. मैं तो मतलब और मेरे पास कुछ.
अगर क्विट करेंगे तो 5 नंबर मिलेंगे.
टाइम इज अप.
Yes, what is your answer?
सर क्विट करेंगे तो 5 नंबर्स मिलेंगे.
क्विट करेंगे तो 5 मिलेंगे. सही बता देंगे तो 10 और मिल जाएंगे. And if you get it wrong, then everything goes away.
अरे चल 5 छोड़ना और देख लेते हैं यार एक बार.
Yes, tell me. Yes, Mukul, that's the spirit. Yes.
बोल दे.
Ectopic pregnancy and UPT.
So he's saying could be ectopic pregnancy. Absolutely right. The answer that we were suspecting was it could be a ruptured ectopic pregnancy, and because the patient is unstable, hemodynamically unstable, we'll go for a laparotomy. And there are the differential diagnoses like ruptured ovarian cyst, adnexal torsion, salpingitis, ruptured appendix, cholecystitis. These were all considered as differential, but in such a case where you have a triad of abdominal pain, vaginal bleeding was also mentioned, amenorrhea, we'll think ectopic, and they get 10 marks. Great. So this unlocks the next question for you. in the next question, I will show you an image. I'll show you a question. I'll tell you the question, but there the possibility is to get 20 marks. Okay, ready?
Yes, sir.
Okay. Connect the dots. Connect them together and tell me
Yeah.
how can you connect them all?
Sir, this is differentiation. Wait, differentiation
रुक
syndrome
जा
है.
पहले, सर को मत बोल तू पहले
मैं
मुझे बता क्या बोल
बताता
रहा
हूँ. देख डिफरेंशिएशन
हाँ।
सिंड्रोम है. ये AML APML है. ये एट्रा दे रहे हैं. ये लंग्स के अंदर
हाँ, हाँ।
इन्फिल्ट्रेट हो रहे हैं
हाँ
और
हाँ सही जा
डेक्सा
रहा है,
उसको ट्रीट करने के लिए दिया जाता है.
हाँ हाँ सही है, बस डन है।
डिफरेंशिएशन सिंड्रोम
So what is your
क्या
final
क्या क्या
answer?
मतलब डिफरेंशिएशन सिंड्रोम होता है
हाँ
जैसे
हाँ हाँ
APML.
हाँ ठीक है ठीक है ठीक है ठीक है ठीक है, टारगेट सेल भी है, ठीक है ठीक है।
What is your final answer?
सर डिफरेंशिएशन सिंड्रोम APML के ट्रीटमेंट के लिए एट्रा जब देते हैं तो सर लंग्स के अंदर मतलब पल्मोनरी सिम्टम्स आने लगते हैं तो उसको ट्रीट करने के लिए डेक्सा देते हैं. तो ये 4 are connecting towards differentiation syndrome.
Absolutely right. Correct answer is differentiation syndrome. With the first image was showing you dexamethasone. The second is showing chest X-ray with infiltrates, peripheral blood smear of APML, and ETRA structure was given to you, which I think you were correctly describing, and you get another 20 marks. So you are making good use of this set now. Another question coming your way, this time for 40 marks. You have to identify the disease shown to you.
क्लियर नहीं है फोटो.
इमेज में क्या है? इमेज में क्लियर दिख रहा है तुझे?
The flare MRI. This is MRI of the brain. Flare MRI.
Sir,
These are
the other
axial
one.
images, coronal images.
देखो प्राइम
Sir, the other one.
लग रहे हैं.
जो रिसेप्टर टाइप दिख रहा है ना, वो क्या है?
क्लियर नहीं है फोटो.
रिसेप्टर क्या है? ये रिसेप्टर है क्या? एंजाइम है?
तो वो लग रहा है वो होगा बीटा प्लेटेड शीट होंगे, प्राइम प्रोटीन्स दिखाना चाह रहे होंगे और ये क्रूडफॉल जैकॉब डिजीज का वो ही होगा, लेकिन श्योर नहीं है.
नहीं नहीं यार, क्रूड CBZ तो यार बहुत ही के किस बेसिस पे बोल रहा है तू CBZ?
टाइम इज अप.
ये बीटा प्लेटेड की शीट के बेसिस पे बोल रहा हूँ. ये बीटा प्लेट जो शीट है और
रहने
फिर
दे।
ये
इतना रिस्क भी लेना सही नहीं है।
ठीक है, चल ठीक है, कोई करते हैं.
तू अगर लेना चाहता है तो ले ले, कोई इशू नहीं है।
नहीं
मैं
यार,
तो बोल रहा हूँ बस
रहने दे ये ज्यादा हो रहा है.
हाँ ये कुछ ज्यादा ही हो गया, पहले तो चल फिर भी ठीक था।
हाँ ठीक है सर, वी आर क्विटिंग.
So they are not playing this round any further, which was a smart thing to do. This is not CJD. And what we can see in this image is, you can see there is hemiatrophy of the brain. Hemiatrophy of the brain. If you see hemiatrophy and you see this is the glutamate receptor. So you have anti-glutamate receptor 3 antibody. Can you now guess the disease? Rasmussen's encephalitis, where you have progressive hemiatrophy, and also the patient can have cognitive defect, behavioral defect, seizures, weakness. Anti-glutamate receptor 3 antibody is the cause. Hemispherectomy is effective. So that was the summary of Rasmussen's encephalitis. So good that you did not attempt. Smart thing to do, but you have already scored good enough. If you had got this right, you would have seen this question. Okay. If you had got that right, this is just theoretical, not for any marks. 18-year-old male, ascending paralysis in both the limbs, diagnosed to have GBS, given IVIG, day 3 altered sensorium, bladder involvement, clinical sign, diagnosis and sign you have to tell. Any guesses?
No sir.
Okay. So actually this is percussion myxedema. That is what mounding of muscle that happens at the percussion site and disappears over a few seconds. It is seen in paralytic rabies, ascending paralysis with altered sensorium and bladder involvement. Patient worsened as it was misdiagnosed and treated as GBS. It was percussion myxedema in the answer. So it was a tough question, but I think you've got 3 right. I think the scorers have got it right. Can I continue?
Yes, sir.
Yes. Okay. So now I go to the team 4. Team 4, are you set now? Team 4
Yes,
from Arush Dhamecha and Ayan Agarwal. Yes? All
Yes,
set?
Yes, sir.
Okay. Your first question for 5 marks. Identify the scientist. We all know him. You definitely know him.
कौन है ये?
One of the most common question that I always put in a quiz.
जेनर वेनर है क्या? आयन
एडवर्ड जेनर, हाँ वही बोल देते हैं यार. कुछ फ्लेमिंग.
जेनर है या वो कॉलेरा वाला है? जॉन स्नो वगैरह है? जॉन स्नो तो ऐसा नहीं दिखता. नहीं,
जॉन स्नो नहीं है.
नहीं है
I'm sure rest of the
Jana.
participants are itching to answer. Okay, final answer. Time. How much
Time
is
is
time?
up, sir.
Time is up. Final answer.
एडवर्ड जेनर ही बोलते हैं क्या?
नहीं पता भाई, मुझे बोल दो।
सर एडवर्ड जेनर.
So I'm sorry we cannot give you any marks, but I'm sure you have seen him in your first year.
Sir, Henry
He
Gray.
is.
एवी ल्यूवेनॉक.
He is.
Henry Gray.
एवी
He
ल्यूवेनॉक.
is the author of the Gray's Anatomy, and I'm sure you must have seen him somewhere, but it happens. It's okay. So unfortunately, we will not be able to go beyond this for you. So, but if you had got this right, are you curious to see what other questions you would have got?
Yes sir.
The next question would have been this. X is a quaternary ammonium compound which is required for transport of long chain fatty acids into mitochondria. X is low in preterm babies and supplementation is required. Identify X.
Creatinine.
What do you think? Anybody else? This is not for any marks because you could not get the first question right. So there no marks. Anybody from the audience can also answer in the YouTube comments.
Carnitine.
Correct
Carnitine.
answer is definitely you're right. Carnitine. Carnitine was the answer. If you had got the first one right, this was the second question. And the third question was you had to identify A and B in the image shown to you. I'm putting myself out of the frame and you need to mention a drug for it. A and B have to be identified and you need to mention a drug. So because this is for no marks and I am sure many of the people on the live chat will also be answering. So A was PCSK9, the drug was eliruzumab and evolocumab, and B was ATP citrate lyase inhibitor, bempedoic acid. Okay. The fourth question was identify the graph with respect to forensic medicine. Anybody has an idea? In forensic medicine, what graph is this? This is? Anybody from rest of the participants?
Poroscopy.
Anything else?
Nomogram.
So correct. It is Hensche's nomogram. Correct. Yes, I'm sure you. If this was your question, you would have got it right. It is for Algor mortis. And the fifth question that I had was identify the technique and tell us where it is used.
So vaccine production in blue king crabs, it is used in COVID vaccination. So king crabs are eliminated, the population has decreased very much due to this rampant COVID vaccination.
I'm sure you're on the right track, but the question is actually showing you something else. On the image, you can see there is some endotoxin written there. If you notice endotoxin on the top here.
Meat crab, this is.
Yeah. So actually the answer was this is Limolus amoebocyte lysate assay extracted from horseshoe crab and used for gram-negative endotoxins. So this was the round. I'm sure you all know that how one of the team could utilize this round so far. Now the next question is for team E. I would request Deep Bhuva and Devanshi Shah from Gujarat to open their cameras.
Yes, sir.
All set? Okay,
Yes,
all
sir.
set to go. I will show you the first question for you. Identify and mention two hormones related to this. Some images there. You need to mention two hormones.
The hormone.
GH કેવું લાગે? LHFSH.
Sir, is it LH and FSH?
What is the image showing you? Why you are saying it LHFSH?
Time is up.
Okay. Anybody from the audience wants to answer? If this is not the answer that we have with us. Anybody from the audience wants to answer, or other participants wants to play this?
Janus kinase, sir. Janus kinase.
Sir, Janus kinase.
Perfect. The image was about Janus kinase, two-faced god, each one end of one and beginning of the other. December and January, growth hormone and prolactin was the answer. So unfortunately, you could not score anything in this round, but I thought, learning purpose, I will show you other questions that we had. Okay. You have to look at this question. Next question. Organism X was first isolated from a diseased brain of a patient with lymphoma who was dying of Y. Y is a demyelinating disease which occurs usually in immunosuppressed persons and is the result of oligodendrocyte infection by X. Histopathology of Y is shown below. Identify X and Y. What is the organism? What is the disease? Just for theory now. There are no marks now because you got the first question wrong. Anybody else in the participants? Anybody in the audience also start typing? There is demyelinating illness due to oligodendrocyte involvement. MRI shows you white matter involvement. Immunosuppressed patients. Can you click something now?
JCPMLE.
JC virus.
So they actually answer was JC virus
Yeah,
and
JC
PMLE
virus.
was what we were looking at. That was the second question. So if you had got that right, I would have shown you the third question at increasing difficulty level. The question was new anti-IL-36 receptor monoclonal antibody for DITRA syndrome or generalized pustular psoriasis flares. That was the third question. Anybody wants to answer the tough question now from the participant or the audience? Okay. So the correct answer here was cipostilimab. A DITRA syndrome, deficiency of IL-36 receptor antagonist syndrome, generalized pustular psoriasis flares. Now, identify the nomogram. This was the next question that we had. Anybody wants to tell me the name of this nomogram?
Rumac Matthew normogram for paracetamol biosimilar.
That is not right. Anybody from the audience or the participants wants to try again just for the theoretical purpose? This is the
Queens.
You see some serum bilirubin level written there.
Queens.
Any thought? Serum bilirubin here.
Queens, no.
So this was actually Bhutani's nomogram to determine risk based on hours of age and serum bilirubin level. So that was the question that we had. And the fifth question was, what are two new components which have been added in MELD 3.0? This was the topmost question in this section for you. If you had gotten all four, this would have been your fifth question. Anybody wants to give us the answer? Two new components of MELD 3.0. Very important question for your
Sodium.
Albumin, sir.
Albumin is right. Yes. What is the other one?
Female sex. Female sex.
Gender. Yes, correct. So gender and albumin are now the added parts, and I think these two boys are rocking the show. They've answered a very good answer, but unfortunately we can't give you any score here. So we go to the team F for their questions now. Team F now. Team 6. I want you to now Monmita Murugan and S. Pragadish from Madurai, and both of them from Tamil Nadu, to put on the cameras. Right? Yes. Set. Okay. So I'll show you a first question to open the account. Okay, this is your first question. Lazare Riviera described in 1646 a patient presenting with palpitation, irregular pulse who died after a relatively short course. At autopsy, round carbuncles were found in the left ventricle resembling a cluster of hazelnuts, filling up the opening of aorta. Which disease am I talking of?
Pragadish?
Filling up the
cluster of hazelnuts. This was the autopsy description of this disease, first time in 1646.
Sir, papillary fibroelastoma.
Unfortunately, it is not correct. So we will not be able to give you any marks. But theoretically, let's see if anybody else from the audience and the participants wants to try and give us the answer.
Disease.
Is it rhabdomyosarcoma?
Sir, irregular pulse, endocarditis.
Correct. The correct answer actually was infective endocarditis. This is the first ever description of infective endocarditis in the literature. So unfortunately, you could not see the other questions. So because it's the learning activity, I again want to re-emphasize, this is not about participating. It is about learning all the time. Not about winning. It's about learning. So let's see more questions. Name the drug which was used for adrenoleukodystrophy. So MRI shows you posterior involvement. This is adrenoleukodystrophy. This is a special child here, and there is a drug based on this movie that is being shown to you here.
Lorenzoil.
What is the drug?
Lorenzoil.
Perfect. This is the story was about Lorenzo was the name of the boy. It is Lorenzo oil, which is glycerol trioleate and glycerol urosate 4:1 reduces VLCFA. Okay. And the next question was to connect these two images. Anybody from the audience and the participants wants to quickly try connect the two images. What is the
Reed
first
Sternberg
image?
cell.
Reed Sternberg cell. Perfect. What is the second image?
Infection.
ABVD regimen.
Again,
EBV infection.
so in Hodgkin's lymphoma, we have given ABVD regime as the treatment, and the image is showing us bleomycin-induced flagellate dermatitis. Called as flagellate dermatitis. That was the question for the third, and the fourth question that you would have seen would have been this: a P2L1A1 presented to OPD with pain abdomen, previous history of molar pregnancy which was evacuated, and an image is shown to you. What is your diagnosis? The HSG image is shown to you. What is your diagnosis? Okay, not for any marks, just for theory. Anybody wants to try out? Evacuation after molar pregnancy, you can see a image showing you something in here. You want to tell us what is happening?
Adolescence.
Asherman syndrome.
Asherman. This was absolutely right. This was Asherman syndrome. Well done, beta. Asherman syndrome. And if you had gotten so far, which none of the team has gotten so far, mostly, we see that in this round, people have not gotten so far, then you would have seen this question.
Brun's nystagmus.
So there is a kind of nystagmus shown in the image, and the CT scan show you a cerebellar lesion and a CP angle lesion actually. So the question was, what kind of nystagmus is this? Anybody?
Brun's
nystagmus is correct. So the correct answer was Burns nystagmus, which you already mentioned, which is correct, and it occurs in CP angle tumors, cerebellar flocculus, and peripheral vestibular system. So this was this round that we had for you. I hope you enjoyed the round. It was tough, but if you notice that questions were in increasing difficulty level, so that we can give you the multiplier effect. I will request the scorers. I will request all the participants to put on their cameras, and if the scorers can give me the final score also.
Yes, sir. After round 4, the score is team A is 30-30, team B is 70, team C is leading with 75 marks, team D is 35, team E is 35, team F is still 25.
Okay. So with this, I think, it's still neck to neck. So next round can be, next two rounds, which are the final two rounds, can be make or break. Next round is the buzzer round. Now, how will we do buzzer on a virtual quiz? What I will request is one member of each team can remain on screen. Okay, one member from each team can remain on screen. And as soon as I show you the question, you can say your name like this. You can say team A, or you can just say A. So me and the scorers will be looking at you, and anybody who says like, you understand, if you're team B, you can say B, C, D, E, F. So based on that, anybody who speaks first will be given the question. 15 questions will be in the buzzer round. If you get it right, you will get plus 20. If you get it wrong, you will get minus 10. If you press the buzzer, 5 seconds will be allowed to answer the question. Okay, everybody correct? Clear? So from team A, who is there on the screen from team A?
Sir, I Mayuk Hajra.
Mayuk, very good. Team B?
Sir, I will remain Soumya.
Soumya. Team C?
Sir, Mukul.
Mukul. And team D?
Sir, Arush.
Arush. E? Deep. Deep, I request everybody to, unmute yourself so that you can, quickly, loudly say, otherwise, you will. Huh?
Team F, sir.
F. Pragadish. Okay. Okay, ready?
Yes, sir.
You have to say your A, B, C, D, F, whatever your team is. And anybody who says this first, we will give you the option to answer the question. Okay. You have to fire your answers very, very fast. Okay. Are you set? Are you ready? Are you ready? Identify the drug shown in the image to you. Anybody is pressing the buzzer?
No, sir.
Okay. So let's see if anybody in the audience is answering. But by the time anybody of the non-participating partners also want to answer now, because okay. So no marks now. We are calling this as a dead question now because nobody has to answer.
Sir,
Correct
if
answer was
the participant wants to say like, अगर मेरे team member नहीं बोला and I want to speak for him, then what?
okay. Okay, we'll give you this liberty by now. All of you can put on your cameras now, and anybody wants to now answer. Let's see. Anybody want, but you have to say your team name first. Team?
Sir, team C.
Team C. Yes, team. But tell me.
Yes, sir. Sir, Mukul. Sir, the scientist is Oldham Kelsey and thalidomide for thalidomide.
Correct. Correct. The drug is thalidomide. You have identified the scientist also, and the scientist reported focomelia to FDA and banned the drug initially. So I think they deserve full marks. So again,
Excuse
I
me, sir.
repeat. हाँ.
Sir, can we do this like both of the participants? अगर हम दोनों में से किसी को भी आ रहा है, can we just go
Yes.
for it?
Okay, so let's do this. From this question onwards, all the participants can remain on the screen and speak up. But any team who says that A, then any of them can answer. But if you answer it wrong, I will not allow the second participant to speak. So that is how it is. Okay, ready? Okay, second question. So team C got the mark here. Kanika and Rakesh, I hope you got it. Okay.
20.
Okay, next question. Identify and mention his contribution.
Time up, sir.
Time up. Anybody? Anybody from the audience? The person is, we all know him, Charles Montu. Is the man behind the intradermal skin test for tuberculosis. Next question. On your marks, identify the maneuver.
Team A.
Team A.
Sir, we told first team.
Team A. Yes, team A.
Sir, yes, we told.
Sir, I actually said A instead of B. I thought that I was A.
F I told first.
Kanika, which team answered? Team A. Team A said first.
Yes.
বলো দাদা
ওই থাকনি এটা তো হচ্ছে না যে ইয়েতে শোল্ডার ডিস্টোসিয়াতে দিচ্ছে
Sir, they can't discuss now.
Team A, now you
They are
no
taking
time
so
to
much
discuss.
time.
Give the answer.
তোমার জাম না
Name
Sir,
the
actually,
answer.
Shivam had
Sir, I had
peanut.
said A.
It is a peanut man.
Team A is saying Pinard maneuver. We are cutting.
No
their
sir, no
marks.
sir. We have not said peanut, sir. We have
Sir,
not
they're
said
taking
any
more
other
time,
team has
sir.
Say
कुछ तो
something.
बोलेंगे. Sir,
Shivam has
say
said
something.
said sir, in shoulder dystocia we are giving the pelvic pressure.
Name the maneuver. Name the maneuver, not what is happening here.
আর দিয়ে রবার্ট কিছু একটা নাম
Sir, no, Robert Manuel. No.
I think we have given you enough time. 5 seconds was the limit. Although there are no more marks to be won in this question, anybody from the rest of the participants wants
One
to?
mark.
Team F.
Cox
Craig
Marshall.
Minower. Team
One
F.
Marshall.
Team F. Craig Minower.
Sir,
Team
team
F.
C, Brad.
Craig Minower.
One
Craig
Marshall.
Okay, but we are not giving any marks on this question to anybody now. The answer was Bracht maneuver. Delivery of fetus in breech position was what was being shown to you in the image.
ব্রিজ তো
That,
ধরে
that was not shoulder, that was the breech. Okay.
হ্যাঁ ব্রিজই ধরেছিল এই জন্য
Okay. Next image. Ready. Okay. So that is why I wanted one of you to be on the screen. Otherwise, it becomes a little messy. So if you all the participants agree, I would again want at least one person on screen so that.
Sir, can you just
Sir, what
give
I
some
feel
time?
is
My
like the
device is logged out. Just give some time,
Sir,
sir.
what I feel
Sir,
is
that is
just
why
we
I'm putting
answer
it.
किया है, so the team member has to answer immediately. Like they can't discuss anymore.
Yes.
If they have put up.
Yes. Because last time, because if you are discussing, it is not in the spirit of the game. It is not a long question. 5 seconds is the time allowed to you. So don't discuss. Give the answer if you are allowed.
Sir,
Okay.
please 1 minute, sir. Can you please wait for 1 minute? My teammate Shivam has logged out.
Okay, I'm waiting for your Shivam teammate. Yes. All set for the next question. Is Shivam back on the screen?
No, sir. No, sir.
Can you call him up?
Yes, sir.
Give it with him sitting with him. Yes, sir. There is some problem.
Now we can start.
Yes, sir. Yes.
Okay, set. Okay. Next question. On your marks. I want to hear your name or your team's name to be sure who is answering it first. I did mention the type of shot. B.
Team F.
Sir,
Hawk
Team
position, sir.
sir, can we explain it? Sir, can we
This
explain
position
it?
asphyxia, sir. Type of torture is position asphyxia.
What is the name of the
Hog-like
torture?
tying, sir.
Team F.
Hog tying.
Faster.
Hello. आवाज आ रही है? हाँ, आवाज आ रही है, बता हॉक टाइम तो है, हॉक टाइम बोल तो रहा हूँ.
Sir, am I audible?
Pragdish, you are audible, but what you are saying is not understandable.
Sir, parrot perch.
Okay. The answer that I have with me, okay, I'll just show it to you so that we can decide if you're answering right. Answer that I have with me is this: incapacitamento. This is the torture
Sir, that is also known as hog tying, sir.
So are they right?
Okay.
Are they right? Have they answered it correctly? What do the rest of the teams are? What are you saying? Because I don't have the second name for it.
Sir, teams are not telling the team names. They are not telling the team
That
names.
they did not tell the
So,
team
bit-
names.
No, I just
Team F ने answer करा.
You can't just say.
Team F
means it is creating
सही आंसर था कि
confusion.
गलत था?
वही है सर, वही है हमारा हॉक टाई है.
Same है ना? So I think we can give it to Team F, है ना? We can give
Sir,
this score
team
to
B, sir.
Team B. अच्छा.
Sir, team B. सौम्य.
अच्छा, Team B. Okay, Team B. Okay, we can give the score to Team B. Team B answered it right. Okay. All set now.
भाई डिवाइस में कोई दिक्कत है यार.
सर मतलब पहले आंसर टीम एफ ने दिया, कुछ और आंसर दिया था, फिर
हाँ
दो
सर,
सर, हम लोग को
पहले टीम एफ ने प्रगदीश ने बोला था
Yes,
हाँ,
sir.
कुछ आंसर,
Yes, sir.
उसके
And that
बाद
was wrong.
देन बी ने
Yes.
बोला था.
मुझे लगता है कि इसमें ना ऐसे ही एक ने आंसर किया तो दूसरा ना करे, क्योंकि एक ही बार आंसर कर सकते हैं बजर को. सो वील हैव टू गिव
Yes, sir.
इट.
टीम एफ ने दिया था सर.
No team gets any score here, but
Yes,
Team
sir,
F will
no
get a
team gets
negative mark. Team F का negative
Yes, sir.
mark होगा क्योंकि उन्होंने पहले बजर दबा के गलत बताया.
क्या
Okay.
हो गया था?
Okay, all set. Okay.
Sir, just a minute, sir. Is there a lag? I guess there is some lag, sir. Sir, अभी B बोल रहा हूँ, आ रहा है B.
डॉक्टर शिवम, पहले प्रगदीश ने ही बोला था, देन यू हैव सेड दैट.
Okay, so
Sir,
instead
just
of
wanted
saying
to
the
know
answer,
because
na
यहाँ पे थोड़ा network
Shivam,
problem
instead
हो
of saying the answer, say the team name B like
So we
that.
said, sir. So we said B.
But
But
he
before
said F
that-
first.
before that.
And then after saying the
Okay.
name, please
ठीक है.
wait. Let me tell which team to answer, then you answer. Okay. Okay, all set now. All set. You have to connect and identify the drug.
Sir, the screen is not visible, sir, for us. Means it is coming to, means others' face are seen, means shown.
Can you just
screen is not
scroll the I think if 5 6 Kanika, can you just close your window for 1 second? Maybe it might become visible for you. Kanika, एक बार अपना वीडियो बंद करो. हाँ, now are you able to see? अब दिखा?
Yes, sir.
Okay, now tell us. You have to connect the dots. Anybody? Okay, so I think none of the participants is pressing the buzzer, so let me do the honor. The correct answer here is Tecovirimat. Inhibits VP37 envelope protein. Okay, next question, buzzer round. You have to look at the image and tell us the name of the drug.
Sir, again the screen is going out. actually.
Team B, yes.
Crofelemer, HIV associated.
Team B is saying
Diarrhea के लिए.
Clofelemer, which is Kanika, you can come back with your video. So Team B is answered it correctly. They get full 20 marks. The answer is Clofelemer. Obtained from dragon, sap, blood, acts through CFTR and SAC, inhibits chloride channel. Absolutely right. Used for HIV related secreted diarrhea. Team B got it.
Sir, excuse me, I want to give some message to my teammate. ময়ূকদা, তুমি ভিডিওটা পিন করে রাখো স্যারেরটা, নইলে তোমার দেখতে পাবে না, স্ক্রিনটা চলে যাবে.
পিন কিভাবে করে?
ওই রাইট ক্লিক করে, তুমি তো ট্যাব থেকে দিচ্ছ না, অপশন আছে কিনা দেখো, তাহলে স্যারের স্ক্রিনটা পিন করে রাখো, তাহলে ডিসঅ্যাপিয়ার হবে.
পিন করা যাচ্ছে
Sir,
না।
he's all the videos are on, so he could not see the image.
Okay, and also BHU,
I am telling it to
BHU team,
team B.
if you can write Team B, your name on your screen instead of IMS BHU, it will also be easy for me also. Okay, just rename. Yes, rename that team. Okay. Now, are you able to solve?
Sir, 1 minute, sir. 1 minute.
All the teams are comfortable.
रुक जा टीम भी कर लेते। अरे वो पहले वही था ना, सेम रह गया है एक दूसरे क्विज में, चेंज हो गया ना शायद। Yes sir, we have changed sir.
Okay, all set. Okay, now I'm going to show you a question again. You have to name the drug which is C1. Team B, yes.
Sutilimab.
Sutilimab used to reduce the need for RBC transfusion due to hemolysis in cold agglutinin disease is absolutely correct.
Yes.
You get plus 20. C1s inhibitor, complement inhibitor. Perfectly answered. Well done, beta. So team B is on fire now. Let's see the next question now. Next question is slightly longer, and I will just remove myself from the screen a little bit so that you can see. Okay. A 30-year-old woman presents to your clinic complaining of dyspnea with mild exertion, history of smoking, history of using intravenous drugs, including heroin and Ritalin, regular user of cocaine. PFT is shown to you. What is the most probable etiology of what has happened? Okay.
Time is up, sir.
Time is up. Anybody from the audience? Anybody from the teams wants to now, without any marks, wants to guess?
सर इन्फेक्टिव एंडोकार्डाइटिस है क्या सर? न्यूमेटोसील भी दिख रहा है स्टेफिलोकोकस का मोस्ट प्रोबेबली।
वो जो न्यूमेटोसील आप कह रहे हो थोड़ा ऐसे हाइपर इन्फ्लेशन है. सो इफ इट इज हाइपर इन्फ्लेशन, व्हाट कुड इट बी? इट इज एम्फाइसीमा. सो रिटालिन और मिथाइल फेनिडेट causes emphysema. That was the answer to the question. Okay, unfortunately none of them got it right, so I will show you the next question. Question number 9. You have to identify 3 images shown to you. A, B. Team B, yes, team B, tell us.
Yes sir. Sir, जो B है, both in Brugia. B is Brugia, C is without Wuchereria, A is Loa Loa.
So absolutely right. A is Loa Loa, B is Brugia, and C is Wuchereria branchiophyti, and they got it all of them right. Full 20 marks to them once more. Okay, all set to go for the next buzzer question coming your way. You have to look at the image and tell me which FDA approved device that you see here is for indicated in term newborns. Name of the system and the indication.
Time is up, sir.
Time is up. Anybody wants to now just see, or anybody from the audience wants to guess?
Sir, for no marks, can we say?
For team
No
F?
marks.
No
Yes,
marks. Okay, no marks. Just
sir, head cooler for hypoxic ischemic encephalopathy to prevent brain damage.
You should have pressed the buzzer, but you did not. So it is Olympic cool cap system used for moderate to severe hypoxic ischemic encephalopathy to maintain cool and steady state temperature. Also used in BPH and breast cancer. You were on the right track.
Sir, one doubt, sir.
Yeah.
Sir, even if you know that use, is it okay or will we get minus, sir? I did not know the name of Olympic cool cap.
So if I am asking in the question name, then you have to give the name. Okay?
If I had answered, it would be minus only, no, sir.
Yes, but I will be considerate. Don't worry about it. I'll not be unfair to you. If you are very close, I'll give you the marks. Okay, don't worry. Just play. Okay.
Yes, sir.
Next question coming your way. Identify the organism.
B.
Okay, team B, tell us.
Thyris pubis.
They are saying it is Thyris pubic crab lice, which is absolutely correct. They get plus 20 again. Okay, next question coming your way. Okay, slightly difficult, so all of you please be careful. I am showing you 13% of the patients with inferior wall MI may present with this special pattern, misdiagnosed as NSTEMI, deprived of reperfusion. You need to identify the pattern on the ECG.
Sir, South American flag pattern.
I have a different name with me in the answer sheet, so if
time is up, sir.
Which team was answering?
F.
No.
Pragadish had the answer only.
So Pragadish is yet to actually say team F, so I'm not listening to his answer. Anybody wants to say the buzzer?
Time is already up.
Time is up. So the answer that we have with us is Aslanger's pattern. STE in 3, but not in any other inferior lead. ST depression in any of the leads. V4 to V6, but not in V2 with positive T wave. ST in lead V1 higher than ST in V2. Clinical significance is concurrent multi-vessel disease and requires emergent reperfusion. Okay, ready? Next image coming your way. Easy one. Identify the new therapy.
Sir,
B.
A. Team A said it first.
A.
Sir, can you complete the question? New therapy for?
Identify the new therapy and indication for it.
Sir, this is the pneumatic compression because of in case of shock we are giving pressure so that the blood is transferred to other vessels. In case of shock, we are giving.
Yes, sir. External
pneumatic
counterpulse.
external pressure counter.
I need the at least some words in the correct term of the therapy.
External counterpulsation. I think this is an.
Which is the team answering? Team A.
A.
So I think we can give it to them. The answer is enhanced extracorporeal counter pulsation. They said counter pulsation, so I'm giving it to you, and used for refractory angina. Okay, ready? Next question coming your way for buzzing. Very easy one. So be ready now. Be ready. Okay. Identify A and B bodies and condition in which they are seen.
Sir, team C.
B.
Sir, A.
Which team said it first?
Team C.
Team B. Yes. Name the cells. A and B bodies.
Sir, this is Klebsiella granulomatosis. This is safety pin appearance. A wala. Donovan bodies. हाँ. And it is seen in Klebsiella granulomatosis or Klebsiella granulomatis. ये क्या हो गया? नेट क्यों नहीं चल रहा?
Yes, Team B. Yes, I'm listening. So, Team B, I have some other answers with me. So, tell us. So, the answer that I have to this penultimate question of this round, the answer that I had is Pund cells, which are seen in granuloma inguinal and Gupta bodies, actinomycosis. That was the image. This is the image shown to you. And so, unfortunately, we'll have to deduct 10 marks from you. And we have now at the final question of this, of this buzzer round, exciting buzzer round. Let's see how many of you are able to answer this very easy question. Get on your buzzers now and tell me what is this? Identify the fracture shown to you.
B.
Yes, Team B. Yes.
SX low pressure fracture.
They are saying it is SX low pressure fracture, which is absolutely right. Fracture of the radial head and dislocate distal radioulnar joint, damage interosseous membrane. Absolutely right. They get plus 20. So at the end of this round, I think now we should have the scores, and I think Team B has taken a big lead by what I can already see by looking at the boundaries that they have scored here. So scorers, are you ready with the scores, or should I go to the last round?
We are ready, sir.
Okay, last round again. I will need one of you to answer, because otherwise I cannot, take, the two answers. It becomes very difficult for me to take. So what I'll do is, from each team, one person has to become the speaker, and all others will put their cameras off. I will do a rapid fire set of questions for you, 10 questions. And then you will be answered. So from Team A, who is the person who will go on the screen with me? And rest of you can switch off your cameras.
Sir, 1 minute, 1 minute break can I get?
Yeah, you can take 1 minute break, but don't log out from your video conferencing.
Yes,
I'll ask Kanika and Rakesh, our scorers who are patiently sitting since afternoon till night to do the scoring. Big round of applause for them. Please tell me, what is the score so far? Team A, what is the score of Team A?
Team A is on 50.
Team B?
Team B 160.
160, awesome. Team C?
Team C is on 95.
And Team D?
Team D is on 35. Team E is also on 35. And Team F is on 15.
Okay, now we are at the final round, which will determine the winners of DAMS Gray Matter. And before we start the quiz, because one of the participants is taking a break, I think he's going to read his Harrison's in 1 minute. So let me ask Kanika and Rakesh, what is the prize for this quiz? If they win, what is the winner taking home?
The 50,000 cash plus the DAMS course, any course, 100% discount on that.
So if you win this
হ্যাঁ, আরে
round,
তুই কিছু
if you
বলতে
win
পারলে
this
সেটা
quiz, you
বলার
get
জন্য
50,000 rupees and you get a free enrollment to the DAMS regular or DAMS ultimate live course, whichever you want. And team, if you come second, what do they get?
25,000 as a cash and 50% discount on our course.
So I will improve this. So if you are second, again, we will give you 25,000 cash, but we'll give you free enrollment in our
Free
DAMS
enrollment.
course. And team C,
15,000 as in cash plus the course of the DAMS.
perfect. So the prizes are 50,000, 25,000 and 15,000 and one course that you can take. So that's a very high stake game. So
Sir?
are you ready now, team A?
Sir, can it be made possible like that? You can take one answer from each team, the first answer that each team can give, so that both of the members can give the answer as a team.
Okay, so okay, we can try that. We can try, but
First
anybody who
answer.
speaks first, I will take that
Yes,
as
sir.
the answer.
Yes, sir.
But no discussion amongst yourself, otherwise it
Yes,
becomes
sir.
very difficult to finish. It has total
Sir,
1
if-
minute is there.
Sir, if team members cannot discuss, then sir, what is the time
Okay.
per question?
Okay, okay. What I'll do is I will show you the rules and then we can allow you can switch on your camera also.
Okay, sir.
Agni Mukherjee also.
Yes,
Okay.
sir.
So what
Yes.
will happen in this round is I will show you 10 questions. I will show all the questions together. You have to answer in 1 minute. If you answer it right, you get 5 marks. Okay, you can discuss and everything. You can do discussion, but answer has to be given only by one person. First
Okay.
told answer will be taken. My decision will be final. Okay. Are you okay?
1 2 3 4
Sir, all the questions will
okay
be
sir,
shown at the same time.
Yes,
okay sir,
all
then
the
after
questions
1
will show
minute
together.
we will be given 10 seconds to answer within that. Means after 1 minute we will be given 10 seconds.
Total 1 minute. Total time 1 minute for this round. Okay.
Okay, sir.
In 1 minute, I will keep saying the question. You can keep answering. The
Okay,
one
sir.
person, one person can think of the answers also, so that because you're a team. So one person is answering, other can think also, and you can discuss. But the time is 1 minute. I will take
Okay,
the first.
yes sir, I am discussing one thing. ওইটাকে তুই নাম্বার 1 to 10 লিখে রাখ, ঠিক আছে? যেটা পারবি না সেটার একটা শর্টকাট লিখে রাখিস, ঠিক আছে? দেন তারপরে তুই অ্যানসার করে দিবি। তুই লাস্টের থেকে যদি এক এক করে যদি কোশ্চেন দেখে না, তুই মানে লাস্টের থেকে স্টার্ট করবি, ঠিক আছে? আমি ফার্স্টের থেকে।
ঠিক আছে, ঠিক আছে।
ঠিক আছে, ওকে স্যার, উই আর রেডি।
ঠিক আছে, তুমি কোন থেকে? তুমি ফার্স্ট থেকে, আমি লাস্ট থেকে স্টার্ট করব।
আমি ফার্স্ট থেকে, তুই লাস্ট থেকে।
ঠিক আছে।
Okay, are you ready now? Team 1.
Yes sir.
Team
Yes,
A.
sir.
Yes sir.
Okay, the final round of DAMS Grey Matter 2022 for a big prize, and we are starting your questions now. Nervi fussalis. Any answer?
Yes sir.
Most sensitive mechanoreceptor. Drummond syndrome. Any answer? Please keep answering, beta. Who is answering?
দাদা 8 মনে হচ্ছে।
তুই বলে দে, তুই বলে দে।
নাম্বার 8 is cardiac MRI.
Correct. Number 8 is cardiac MRI. Correct.
Gold standard LV function ambition trial.
আচ্ছা, হেমোফ্যাগোসাইটিক লিম্ফোহিস্টিওসাইটোসিসটা কিছু জানো?
Sir, nervi fulcralis is L4 L5 branch from
It's
the
a ventral rami,
nerve.
ventral rami of
Ventral.
rami of L3 L4 এরকম কিছু হবে।
Okay, we will give you the first answer also. Correct. Anything else?
Sir, is there any
Sir, as down media is seen in sir Burkholdia. As down media is
As down media is
pseudomyelin.
Burkholdia is also correct.
Pseudomyelin. Dumont syndrome.
TIVA.
Time up, sir.
Sir, full form of TIVA. Yeah.
Which question are you answering? Can you?
Sir, last one. 10.
What is the agent of choice for TIVA? What did you say?
No, sir, I was asking the full form.
Okay. So I think you got three correct. So I'll tell you the answers so we can decide then. So the correct answers were these. Nervi flucalis was L4 nerve root. I give it to you. Most sensitive mechanoreceptor was Pacinian corpuscle. Drummond syndrome is bacterial breakdown of tryptophan. Marquis sign is seen in Leishmania. Ashdown medium for Burkholderia. New monoclonal antibody for HLH. Imapalanomab. Bergsonian bias was formed. Selection bias when both exposure and disease are affected by selection. Gold standard for LV function, cardiac LV function or cardiac MRI. You got it right. Ambition trial was done for amphotericin B in cryptococcal meningitis. Agents of choice for TIVA was propofol and remifentanil. So I think you got 1, 2. I think you got 2 right.
3 as down.
You got 3 right.
Cardiac
They
MRI
got
and
3 correct. Okay. So I think we'll keep this pattern for this round. I will not speak the questions because that is confusing you. So what I'll do is I'll show you on the screen. You can discuss among yourselves and one of you can answer. So team B now. Team B now you can get ready. Within the allotted time, you can answer as many as possible. Team B, are you ready?
Yes, sir. Yes, sir. Ready, sir.
Okay, Team B. Akash Anand, I'll request you to close your camera so that only the participating team is there. Okay, now let me show you the next set of questions.
Braille system, Meissner corpuscles.
While loop is 4, lupus nephritis.
4 is lupus. Are you answering your final answers?
Yes, lupus nephritis.
Correct. Yes, 4 is correct. Lupus nephritis.
Investigation of choice for DIA is MRI. Fetal anemia in utero is middle cerebral artery peak systolic velocity.
Short growth is seen in yersinia.
Yersinia.
Correct.
और क्या बचा में? Mechanoreceptor number 2 is Meissner's corpuscles.
Meissner is wrong.
Hawthorne is recall bias. The patient cannot recall. Hawthorne is recall bias. Hawthorne effect. The patient change their अपना behavior change कर देते हैं ना.
Behavior change कर जाता है.
In the each of the trial.
Correct.
और क्या पढ़े हुए हैं यार ओटहाउस.
अरे ओटहाउस सिंड्रोम में पढ़ा हूँ यार.
और क्या बच रहा है एंजल साइन भी नहीं आता है. नर्व एरिजेंटिस यार वो इरेक्शन से रिलेटेड था यार वो.
तो L1 बोल दे.
S2 to S4 बोल देते हैं सर. S2 to S4.
Time is up, sir.
Okay, so time is up. So what I'll do is I'll run through the answers and see which one of you got which. So nervi erygentis is pelvic splanchnic nerve, which you did not say. Mechanoreceptors responsible for reading Braille system are Merkel cells, which you did not say. Osthaus syndrome is malabsorption of methionine and neutral amino acid. You did not answer this. Wire loop in kidney biopsy, HIV nephritis and class 4 lupus nephritis. You said lupus, so we are giving you this correct. So this is the first answer that you have got it right. Female sexual stimulant is flibanserin. You did not get it. Stellacide growth in ghee is Yersinia pestis. You got it right. Hawthorne effect is study effect where subjects systematically alter their behavior when they know they are being observed. You got it right. IOC for diffuse external injury is MRI. You got it right. Angel sign is seen in horizontally placed testes due to mesorchium. You did not answer this. Surveillance of fetal anemia is done by fetal MCA peak systolic velocity. This is you answered correctly. So you have given, I think, 1, 2, 3, 4, 5 correct.
5 correct.
And yes, you given 5 correct. Well done. So I think you're already taking a big lead, Team B. So let's see how other teams perform. So I'll now ask the team C from Delhi, MAMC Delhi and ACMS to put on their camera, Akash and Mukul to put on their cameras so that I can give you time to answer your questions. Are you all set now? Ready?
Yes, sir. Yes, sir.
Okay, Mukul, you are on mute, so maybe you can unmute yourself so that easily you can discuss. Okay,
Sir,
ready?
Sir, he will answer first, then जो भी बचा हुआ है वो मैं compensate करूँगा. So that's our plan.
ठीक है, जैसे भी कर लो. 1 मिनट है, मैं क्वेश्चन आपको दिखाता हूँ. ठीक है, set 3, ready?
Yes, sir. Nervy hesitance, पता नहीं. Skin stretches sensed by rich. So Nagler reaction is due to Clostridium perfringens, and investigation of choice for ectopic gastric mucosa. Drop metastasis. Drop metastasis is seen in medulloblastoma, and only indication for the use of griseofilvin. So Biswanger syndrome is like hydroencephalitis sort of. Investigation of choice for ectopic gastric mucosa is
technician 99 है उसका. तो 8 का technician 99. 9 का तूने क्या बोला?
9 medulloblastoma.
हाँ हमने मेडिलोब्लास्टोमा और इसका नेशनल हैंड
Time
वॉशिंग
up,
डे
sir.
का
Time up.
15th अक्टूबर 15th अक्टूबर
15th अक्टूबर
Time is
और
up.
निगलेट रिएक्शन बोल दिया ना?
हाँ बोल दिया।
ग्रीसियोफेलिन का फंगस
So I think your time is up. So what we'll do is I'll show you the answers, then we'll decide how many marks we can give you. So nervy hesitance was deep peroneal. Skin stretch is sensed by which mechanoreceptor was Ruffini endings. Enzyme deficient is Rickner-Hanhart syndrome was tyrosine aminotransferase. Lingard ratio is used for detecting vasospasm in subarachnoid hemorrhage. You did not get it. Indication for Griseofulvin tinea capitis. You did not get it.
Sir, I told fungus like उसके पास आ रहा था tinea capitis.
Fungus is too broader term. Nagler's reaction is due to lecithinase activity of alpha toxin Clostridium perfringens. He said it right, so I'm giving it to him. So he got 6 right. National hand washing days is October 15. I'm giving it to you. Correct. Investigation of choice for ectopic gastric mucosa technetium pertechnates. Can you said technetium approximately? I'm giving it correct to you. Drop metastasis is seen in medulloblastoma. You answered it correctly. Binswanger syndrome is subcortical leukoencephalopathy or small vessel ischemic vascular disease. You did not answer it correct, so I'm not giving it to you. So I think you got 1, 2, 3, 4. 4 correct. Okay. Okay. Done. Okay. So now I'll request the team 4 to come on the stage with me, Arush and Ayan Agarwal from AIIMS and VMMC respectively. Are you ready?
Yes, sir.
Okay, let me just get the things right. Now I will again show you the set and you can read and take your time and answer in 1 minute. Okay. Set 4, ready.
सेकंड मीसनर है क्या?
वही होगा।
प्रेशर हाँ ठीक है।
सेलिवनोव टेस्ट मैक्स जोसेफ क्लेस तो उसमें होगा ना लेप्रोसी एलएल वाली एलएल लेप्रोसी।
हाँ हाँ ठीक है। और सिलेक्टिव मीडिया फॉर लिस्टीरिया
नेशनल डीवर्मिंग डे ये हो गया 10th of February और 10th of August।
हाँ फेब हाँ ठीक है।
2 बार करते हैं।
इन्वेस्टिगेशन चॉइस फॉर रीनल स्टोन्स
तो सीटी हो गया एनसीसीटी।
हाँ एनसीसीटी और क्लिप स्टेजिंग पता है?
क्लिप स्टेजिंग लिवर वाली होती है यार, ये चाइना वाइना वाली लिवर एचसीसी बोल देते हैं।
अच्छा हाँ एचसीसी ठीक है।
गटमैन टेस्ट ये हो गया ना लैरिंग्स को लेफ्ट राइट करने वाला, लेरिंजल क्रेपिटस हो गया यार।
अच्छा ठीक है पता नहीं। और 6th इप्रोडिसेट डिपोजिशन
सेलिवनोव याद आ रहा है क्या? सेलिवनोव
तो
यूरिन वाला है ना, यूरिन वाला।
और आर्क ऑफ बार्लो
सेलिवनोव यार कीटोन बॉडीज यूरिन कीटोन।
टाइम अप।
कीटो शुगर्स के लिए हाँ कीटो शुगर्स के लिए।
Okay, so let's see the answers so that we can decide what you have answered correct. So arc of Barco is right and left gastroepiploic anastomosis. You did not get it. Nerve fiber most susceptible to pressure is type A. You did not answer this. Selivanov test is to differentiate between aldose and ketose.
Keto sugars.
Somewhere there we will think about it. Max Joseph cleft is in lichen planus. You said leprosy, so we are not giving it to you. Eprosidicate is used for deposition disease. Answer was amyloidosis. You did not get it. Selective media for listeria was Palcom media. I think you did not answer. National Deworming Day, 10th February. You answered it correct. IOC for renal stone, NCCT. You said CT. I'm giving it to you. Clip staging, hepatocellular cancer. You answered it correct. Gutman sign is nasal stuffiness seen in stellate ganglion block. So I think you got 1, 2, 3 right. As far as I am concerned, I can 4 correct. We can give you this Selivanov test also. So you got 4 correct. Okay.
Yes,
happy? Okay. So now I request team 5 to be on the stage with me, where I want Deep Bhuva and Devanshi Shah to be on the stage. Are you all set?
Yes, sir.
Okay. So what I'll do is I will show you the questions and you can answer them one by one. Ready?
Yes, sir.
Okay, let me show you the questions.
Question here. He first for our automatic bedside test.
Hypoxia type C.
For fiber more sensitive to hypoxia type C.
Beta, I think we will request you to pause here. We are not able to hear you. There is some echo happening. So I think you're both on the same phone. So one of you has to mute the phone. I think you are logging with two devices. Okay, so you can come on one device and then answer. I think we'll be able to answer. Your time is starting now. Please start answering now.
Okay. Nerve fiber most sensitive, type C.
Wrong.
If asked for our injuries, blunt trauma injuries, abdominal dance phenomena.
Portreous microabscess, neutrophilic abscess. Seen in botryomycosis. Dead fetus, Robert sign.
Okay.
Shepherd crook deformity seen in
How much time is left?
avascular necrosis.
5 seconds more. So time up.
Okay, so time is up. So let me give you the answer. So we'll decide how many you got it right. So nerve fiber sensitive to hypoxia type B, you said C. Tomcat urine order is seen in multiple carboxylase deficiency. Portier microabscess are seen in mycosis fungoides. I think you said something neutrophilic, so I'm not giving it to you. Rescue therapy for off periods in Parkinson's is apomorphine. Dyne phenomena is seen in Proteus. I think you did not answer. Finchem test is no break in colored halos. Diagnosis acute angle closure glaucoma was the answer. E fast is extended fast, where you see thorax also in addition to the abdomen. You did not give it correctly. Ipsilateral third cranial nerve palsy, contralateral cerebellar ataxia is Northangle syndrome. And the sign where you see gas in the aorta and dead fetus is Robert's sign. You got it right. Shepherd crook deformity is fibrous dysplasia, Paget's disease, but you got it wrong. So I think only one question you got right. Are you there, beta? Deep and Devanshi,
Yes,
are you there?
Yes, sir.
So I hope you agree that you got one correct. So I'm giving you marks for that answer.
Okay, sir.
Okay. If you think I missed out on anything, you can point out. Okay, all set now for the final final round of the final round of the DAMS Grey Matter 2022. I will invite on the stage Monita Murugan and S. Pragadish from Tamil Nadu. And Devanshi, I'll request you to switch off your camera so that we can have only the participants on the screen. Are you ready now?
Yes, sir.
Okay,
Yes, sir.
done.
So 3 is kidney. 4 is mucinous. 7 is dacarbazine, cisplatin, cladirabin, vincristine.
Time up, sir.
Okay, so your time is up. So what I'll do is I'll start looking at the answers and then we'll discuss. The question number 1 was middle ear cleft develops from. The answer is first endodermal pouch. Most common valvular lesion in Marfan syndrome is mitral regurgitation. Most common extrapulmonary site for disseminated nocardiosis is brain. You said kidney, so that is not correct. Only oral SMN2 splicing modifier approved for SMA was Ridsipalum. I think you answered something else. Akkermansia musciphilia is related to which neurological disease? Was multiple sclerosis. Confirmatory test for acromegaly was GH suppression, growth hormone suppression test. Protocol for malignant pheochromocytoma was Everbook, chemotherapy, carbazine, cyclophosphamide, and vincristine. I think you did not give the full answer. Which microorganism is called as Pittsburgh pneumonia agent? Legionella micadiae. Theme for World AIDS Day 2022 is putting ourselves to the test, achieving equity to end HIV. And final question was Nicaldi Barham sign, bradycardia and hypertension noted when artery proximal to AV fistula is compressed. So I think you did not get any of them correct. So there's no score for you here. So with this, we come to the final round of this DAMS gray matter quiz. I will request all the participants to put on their cameras so that we can have a quick word with them. So first of all, I'll ask the team A to tell us what is their reaction after the quiz. How did you enjoy the questions and the quality of the level of the quiz? Because you are all India winners, so we had to keep the quiz a little higher. So team A, how was your experience?
Yes, the level is certainly a bit on the tougher side, like, than most of the other quizzes, but it was very enjoyable as we could learn many new things, and the amount of questions from updates that is in this quiz is astonishing. Like, you have to be really updated.
See, our entire purpose of a quiz is to make sure that you learn. Because if we keep a
It was a
very
great learning
repeat, so we don't want to repeat the questions from other quizzes, and also we tried our best so that we can do a unique set of questions. And all these updates you will also find in your new exams like INICET. Also, sometimes you will find one or two questions from what we have asked. And I will also request now Team B. What is your reaction now? How was the quiz?
So last time, sir, we were the runner-up. The last time, sir, right? We had a lot of aspirations that this time will be first, and we are feeling very overwhelmed, sir. We are very happy, and also, sir, there were a lot of questions actually, so that eliminated actually the luck factor. That is the thing that we like the most. Also, sir, that round you actually introduced that round of opening the questions in the last gray matter. So we actually got stuck on the second question. We knew the subsequent questions, but since we got stuck on the second question, it was all over for us.
Yeah,
Then-
but it was interesting. The entire idea was that if you keep answering, the reward goes up. Like I think you made it big in the buzzer round. So each person would have different strengths and weaknesses. That is the entire idea of the quiz. Team C.
It was really a very good quiz. It was like it started from history round and then it moved to clinical and then buzzer round. So it was really a mixed bag quiz. It was really a great learning experience.
And Team D, where are you now? Yes, Team D, how are you feeling now? I think the most popular line in the Zoom era is you are muted.
Hello. Sorry,
Yes.
sir. Yes, sir. I really enjoyed the quiz, and there was some mixed questions. Like they were factual also, and on the other side there were clinical ones also. We had to put our thinking uh, into this quiz. So I really enjoyed it, and
And Team E, the Bachas from Gujarat, Team E. I think they've already logged off.
Yes, they have logged out.
And Team F from Tamil Nadu.
Sir, the quiz was very interesting and a wide variety of questions we were able to see, and it was very enlightening and knowledgeable quiz with lots of research advances. And though we are not able to do good, it was a good learning experience.
Actually, we learned many things from this mixed type of questions. Thank you, sir.
That's the summary of the event. It is not about winning or losing. It is about learning. You can always come back and win it big in the subsequent year as well. So I hope you enjoyed the quiz. There are prizes for first, second, and third. So now I'll request the scorers to tell us which team has come third in this quiz year. This third. Tell me the third first, not the first. Third.
So the third, Team A, with the score of 65.
So Team A, Mayuk Hazra and Aithani Athagni Mukherjee from Arjikar, Kolkata and Medical College, Kolkata. You have come third. You get a cash prize of 15,000, which will come to you. And you also get free enrollment in a DAMS course eligible. And you can get in touch with the scorers and the coordinators here to help you further. Kanika and Rakesh will help you. So
Sure. Thank you, sir.
Which team has come second?
So Team C, the Dr. Akash and Dr. Mukul.
So Akash and Mukul from MAMC Delhi and ACMS Delhi have come second. Congratulations. Well done. You get 25,000 cash award, which we will send half of to both of you. And you also get a free course. Congratulations, and we wish you the best.
Thank you,
And
sir.
finally, finally, we really want to know which team actually won. I have no idea.
Team B, Dr. Shivam Singh and Dr.
So,
Soumya.
Team B from BHU, Dr.
Yes.
Shivam and Soumya, they were the runner-ups in the previous quiz, and now they are the winners. Awesome performance. And what is the margin between the winner and the runner-up?
So 185 in Team B.
And the
Team C is 1151.
So
185 and 115.
Okay, so it was not close. They raced forward in the buzzer round. So congratulations, Team B. Shivam and Soumya, you are the winners of DAMS Grey Matter 2022. You get 50,000 cash award plus a free enrollment in a DAMS course where our team will coordinate with you to help you. And I also look forward to meeting you in person also. And I'm again re-emphasizing this quiz has a great legacy. If you win this quiz, you might actually get a big rank in the real exam as well. Now, before we go, I want to tell you all that every time you participate in a competitive event, it will have some winners and somebody will not do well. But don't take it to heart. Think about it as a learning experience. And we have tried our best to include almost so many topics in the quiz, so there is no luck factor here. And I would request all the participants to put on their camera so that we can take the final group picture. I will request my team to take a screenshot. Okay, everybody here, we'll make a V sign. This will go on Instagram, so look your best. Akash, maybe you can adjust the light also. A lot of people will send you some request, after the quiz. So all set for the snapshot. Yes, this goes on the DAMS Instagram page. I wish you all the best. Congratulations on the winning. And people who have, I think the 3 teams who could not win anything in this quiz, I would again request Kanika to get in touch with them so that we can send them the consolation prizes as well.
Sure, sir.
I wish you all the best. Congratulations. It was a pleasure to connect to all of you. Stay positive. Keep rocking the show. Keep enjoying learning. कोई कुछ भी कहे, अगर पढ़ने में, अगर सीखने में मजा आएगा, तो हमेशा आप डॉक्टर अच्छे बन पाओगे. सीखना तो पड़ेगा. It is all about accumulating knowledge and participating. Don't get नेगेटिव कि ये नया क्यों पूछा, नया ड्रग क्यों पूछा, ऐसा कुछ नहीं है. नया ड्रग भी किसी को तो देना पड़ेगा, किसी को तो सीखना पड़ेगा. On this note, I wish you all the best. Stay positive.
Thank you, sir.
Thank you, everyone.
Thank you, sir.
Thank you, sir.
Bye, everyone.